Welcome to Healing at the Speed of Light. Every week we discuss how laser therapy is changing healthcare and how you can benefit. Now here is your host and founder of Laser Therapy Institute, Dr. Jason Rountree.
People are chomping at the bit.
Definitely, I'm sure. 2 minutes late. Facebook's automatic live piece let us down.
Yeah. Well, but we're live now.
We're live now.
And we've got lots of good information
How do you
to
know?
share with us.
How do you know it's good?
Because I know whatever research you bring to us is excellent.
Yes.
And so
Ideally.
I just know it's going to be good because of the topic. And it's all about laser. And you don't bring us bad information.
No, that is one of the great things. There's a ton of exciting research out there, and that's what we like to base all of these podcasts off of.
Yep.
So thank you for joining me again today.
I'm glad to be here. Glad to be here.
If you're not familiar with us yet, this is Kristi.
Hello.
Kristi is a certified laser tech. She's done years worth of laser treatments for patients, and she is our content producer at Laser Therapy Institute, where we help educate doctors and the healthcare providers about utilizing laser therapy for their patients in practice. My name is Jason Rountree. I'm a chiropractor and a certified medical laser safety officer, and I am also the founder of Laser Therapy Institute, where we bring lots of good information to, like I said, healthcare providers, but then also to patients. So today we're talking specifically toward patients, people that have experienced diabetic neuropathy. Before we get into everything, we're actually focusing a little bit less on laser today and a little more on some other things people can do when it comes to diabetic neuropathies, because we know laser works really well for diabetic neuropathy pain. Not only for the pain, but also for cellular repair. So not just covering up pain like gabapentin might, but also trying to stimulate a restorative effect so that there is lasting changes. And again, when we're talking about laser therapy, of course, we're not talking about burning or cutting.
No.
Nope. Very, very safe. Non-invasive light that stimulates a repair process. If you want to know more about how laser therapy specifically affects diabetic neuropathy, there's a couple other episodes here on the podcast, and you can go to the Healing at the Speed of Light podcast on Apple Podcasts or wherever you get podcasts and find those episodes there.
Oh, we can even put them in the link or in the show notes.
Yeah.
So people can look specifically for those titles.
Yeah, definitely.
And help them out.
Definitely. Okay, so, but like the title of today's episode is it says, you know, is there a magic supplement that can fix or cure diabetes or diabetic neuropathy? Is there a magic bullet out there?
Well, people would want that.
Oh, absolutely.
But usually it's not at all that it's hyped up to be.
Unfortunately, yes. So that is the answer for the question today. Is there a magic supplement for diabetes and specifically diabetic neuropathy? No, there is not. There is not a medication. There is not a supplement that just magically fixes or even effectively fixes diabetic neuropathy, which is why we turn to things like laser therapy to try to reverse some of the cellular damage. But I'm not going to tell you that that is a permanent fix or a permanent cure either. This is a very, very difficult problem to solve. And if you've got neuropathy, whether it's diabetic or another type of neuropathy, then you know that treating that neuropathy can be extremely difficult. Yeah. So we are going to talk, though, about what to avoid and a particular supplement that does have some research behind it for helping to reduce the effects, the negative effects of diabetes and diabetic neuropathy. So we're going to give you some really good stuff on a supplement that you could start right away. We're also going to talk about why you shouldn't get involved with some of the other really expensive things out there that you can waste your money on.
Right.
And then we'll kind of tie it up with a look at what to do for diabetic neuropathy in general. So let's start with, first of all, if you get online and look for diabetic neuropathy supplements or diabetes supplements, I've had so many patients come to me and say, hey, I found this online, or this was on an infomercial and it says it's going to fix my diabetes. That's probably not an honest take on really what you can do for diabetes. Even medications like metformin, which help to manage diabetes, it's still a management. It's not a cure.
Right.
Now, in some cases, you can reverse early onset diabetes.
Right.
We know that. We know that is a fact. That is a diet and exercise piece, though.
Things that you can do to help yourself.
Absolutely. You don't have to pay for that.
Right.
You can get a good diet going. You can get exercise. Any kind of exercise can be very helpful. It does not have to be difficult, hard, high-intensity exercise. It doesn't have to be lifting weights, although that is good. You know, even just going for a walk or a bike ride or getting on a treadmill for a while can do a lot for improving the body's ability to handle sugars. And then diet. Restricting your sugar and your carbohydrate intake does amazing, amazing things for helping to reverse early diabetes.
Right. So there are things we can do.
Absolutely.
And then there are things that we need help.
Yes. So a lot of cases of diabetes, people will get further down that diabetes track and not even realize it in a lot of cases. And then before they know it, they already have cellular damage to the nerves, to the eyes, to the blood vessels, which is one of the effects. You know, those are all effects of diabetes. And so in some cases, if we don't catch it early enough, or and type 1 diabetics who are born with a deficiency and inability to produce enough insulin, you know, in a lot of cases, you end up with diabetic tissue damage before you can get it controlled and reversed. And not to say that the diet and the exercise is not important at that point, but then you're dealing with damage. So if you're already at the point where you have neuropathy pain, which is that burning, tingling, stabbing in the feet and legs and sometimes the hands, if you have damage to the eyes, you're looking for things that you can do or things that you can take that will help to reverse or at least limit that ongoing damage.
Right.
So I don't want to leave out the talk about diet and exercise. That is really critical in so many cases. I cannot emphasize enough how big of a deal that is.
Right. I've heard it said, go walk the dog even if you don't have one.
Yeah.
I always like that phrase.
Yep.
You know, so you can get out and walk. And it's a good thing to do.
I've had patients before tell me that they'll go and walk at the mall or at even Costco, you know, and just start walking.
Start walking.
You know, find a place to walk if it's icy outside or it's raining, but find a way to get active and try to be active every day. It does great things for your circulation, does great things for sugars. Okay, you probably already heard a lot of that, but we can't go through one of these podcasts and not mention how important that is. So let's go ahead and move on from that one. And let's say, is there this magic supplement you can get? Go online, find stuff. If you just even type in diabetes supplement, you'll find all kinds of things that people are trying to sell you. And the unfortunate answer is most of those are not going to reverse or cure your diabetes. Some of them may be helpful, but in most cases, they're not going to be worth some of the really high price tags that some of those have.
And could they have some adverse side effects as well?
At times, yes. We know medications in a lot of cases will. There are side effects to things like gabapentin and Cymbalta, which are pain drugs that are commonly prescribed for diabetic neuropathy.
Right.
But yeah, some of the supplements can as well. And some of those supplements may have interactions with each other or with other drugs.
True.
So that's something to be careful of, be aware of, and don't go blowing your money on something that may or may not be all that helpful.
Right.
So what is helpful? Well, we already said we know laser is good. So we're going to move on from laser and say, let's dig into diabetes, diabetic neuropathy, and how a supplement might work, because that's what we have here on the table today as a study from 2011. And I'll give you the title of the study. It is Diabetes and Alpha Lipoic Acid. This is published in Frontiers in Pharmacology. So right there, spilled the beans. We're already talking about alpha lipoic acid. Before we get into that, what that is and how that works, let's recap diabetes. So diabetes is a chronic metabolic disorder that continues to be a worldwide health issue. It is characterized by absolute or relative deficiencies in insulin secretion or insulin action, and it's associated with chronic hyperglycemia. Stop right there for a second. So your body stops being able to produce insulin, or it becomes more and more resistant to insulin, meaning that insulin, which is something your body produces to control sugar levels in the blood, does not work as well in the cells, even though you're producing insulin.
Right.
Drugs like metformin make you more insulin sensitive, right? So that's what happens there. Chronic hyperglycemia means that the sugars are always high. And that's not like feeling like you're all sugared up. That is a really bad thing, because if you have too much sugar in the blood, then it becomes toxic to the cells.
Right.
So that also creates disturbances of how your body metabolizes carbs, proteins, and lipids, fats, which makes the dietary side more and more difficult. The more you get into, the more diabetic you are, the harder it is for the body to really metabolize and manage those levels.
And a lot of times the weight will increase and that sort of thing.
Absolutely.
And then you don't want to exercise. It just compounds
Yep.
the whole system.
That's exactly right.
So.
That's exactly right. Yep. So, you know, in controlling that is a big deal, because like you just kind of indicated, it's a spiral effect. And the more obese you get, the more insulin resistant your cells become also. And then the less active you are. So the more it affects the progression of the disease. As a consequence of the metabolic derangements in diabetes, various complications develop, including both macro and microvascular dysfunctions. And that means that the vessels stop working like they're supposed to. When that happens, you also get a decrease in how well the cells receive nutrients, right? If you don't have good vasculature, then the cells don't get nutrients the way they're supposed to. And so now we start talking about we're losing circulation, and especially out in the extremities, in the hands, in the feet.
That's when it starts feeling like it's falling asleep, and you're not. You lose sensation.
Right.
At that point.
Because you're restricting blood flow. And the example that I love, that I give oftentimes, is if you put your arm up on the back of a chair and you leave it there for about an hour, it usually falls asleep, right? Yeah. What does it feel like? Numbness, tingling, burning. Yep. How do you fix it?
Take your arm off the chair and start shaking it out, and then it hurts.
Then it hurts, yeah. But you're reestablishing blood flow by doing that, right? So that is kind of this process. It happens on a very, very small scale, this microvascular scale, but you're restricting blood flow to those little delicate nerve endings, and so they start to lose their ability to function, which means it starts to get numb, tingly, burning pain, kind of pins and needles, stabbing sensations as well.
And then do those nerve endings die?
They can, if it goes on for long enough, and then you just end up with no sensation at all. Yeah.
So, need to get on this.
Right? Another thing that happens, in addition to the vascular piece, is that you get increased formation of free radicals, which damage the cells, and decreased antioxidant potential, which means that your cells don't make the antioxidants like they do, and that prevents damage, it prevents cellular aging. That all leads to oxidative damage of the cellular components. So not only are we restricting our blood flow, kind of choking off that blood supply to the nerve, but we're also restricting how well the cells can function and how well they can protect themselves. Okay. So when we go from there and we say, okay, what is diabetes? We know what diabetes is with those mechanisms. Diabetic peripheral neuropathy is what we call the nerve damage that goes on and happens with diabetic neuropathy, which we've just kind of discussed. But you have to realize when we're talking about it, the blood flow is a big piece, and so are the cellular effects. So if you're going to reverse or treat diabetic neuropathy, you need to not only improve blood flow, but you also need to address the cellular components, the cellular functioning piece, if you want to restore function and if you want to decrease pain.
Right.
So we're going to talk about lipoic acid, right? I need to find my notes here. There we go. Okay. So we're talking about lipoic acid, like I said, for this title of the study. We're talking about lipoic acid and diabetes. Lipoic acid is a naturally occurring compound, and it's made in a lot of plant and animal cells in the mitochondria. And it acts as a cofactor for pyruvate dehydrogenase and alpha-ketoglutarate dehydrogenase activity.
Now, do we really need to know that piece, or
Not really. It's a good question.
so you're not going to test me on that one?
I'm not going to test you on that
Okay.
one. No.
I can't even pronounce it. So
It is also required for oxidative decarboxylation of pyruvate to acetyl-CoA, a critical step bridging glycolysis and the citric acid cycle. These are all cellular effects.
yeah.
Okay, so when we start talking about the cellular effects of diabetes, reducing the ability of the cell to protect itself, and then we say alpha lipoic acid, we're talking about cellular function. Not so much blood flow, which is an important piece, but the cellular function side, okay? When we just said we need both of those if we're going to restore function in diabetic nerves and make them less painful.
Right.
Okay? So this kind of complex but completely natural supplement you can get pretty cheaply. You can get it many places, and it's been well studied over the years. So we kind of have a pretty good idea of how it can work in diabetes and for diabetic neuropathy patients.
And that it's important.
And that it's an important step in trying to control the cellular damage and cellular functioning side. Right. So how does it help, though? Because most people go, okay, I understand that, you know, you're saying it can help the cellular components. Let's talk about how it can help. And I promise I'm not going to get too into the weeds with this one. But if you want to know how it works, this is how it works.
Yeah.
So number one, it activates other antioxidants. So lipoic acid itself is an antioxidant. It helps protect the cells. But it also activates vitamin E, vitamin C, and glutathione. And glutathione is a really important antioxidant in the cell. It helps to buffer different damages. And so if you can increase the production, the cellular production of glutathione, you're going to protect the cell better. Essentially, what happens is lipoic acid gets into the cell and gets a hold of the vitamin C, vitamin E, and the glutathione, and it helps to take away some of the changes that happen when those antioxidants are exposed to free radicals. So by regenerating those antioxidants and introducing lipoic acid as an antioxidant, you really raise the level of antioxidants in the cell, which help protect it from new damage.
That sounds like a very positive thing.
Right.
I mean, obviously, it's a very positive thing.
And that's important, especially if you have poorly controlled diabetes, because you have ongoing damage that can be happening in the cell. So controlling that damage process, reducing the ongoing damage, is really good. This may not really help repair the cell, but it can help prevent further damage. Exactly.
So it's not necessarily going to reverse it in this case, but it's going to prevent worsening.
Yep. Yep, that's exactly right. Now, another thing that it can do is it can chelate metal ions. Does that sound familiar?
It does.
Okay.
But don't ask me to explain it.
Fair enough. So when you have a toxic level of metals in the body, which can happen with an exposure to mercury fillings in the mouth, or water that has heavy metals in it, which can happen really easily, actually.
Or lead.
Lead is one of the heavy metals, yep. Even too much iron through a supplement can be a heavy metal problem. And what we know from the research is that the lipoic acid does have metal chelating properties. And when you say chelating, meaning that it draws it out of the bones, out of the cells, and helps the body excrete it. So it helps to get rid of excess metals.
Nice.
That's important because those metals are toxic. Whenever you have too much of these heavy metals in the system, and you can tolerate some, but whenever those metal levels go too high, that just adds to the stress and the strain on the body in a kind of similar manner that diabetes does.
Interesting.
The next thing that happens is it helps to repair aging proteins. And we're all aging, slowly but surely. Hopefully slowly.
It happens.
It does. But what happens is as the cells age, they accumulate damaged proteins that have been oxidized, and those proteins stop doing their jobs, which is to help carry out functions in the cell. And so what happens with lipoic acid is it actually reverses those age-related changes and then boosts the antioxidant system to prevent ongoing age-related changes in the cells.
Sounds good.
Some people think that lipoic acid has a really good effect on anti-aging for the skin, even, like facial anti-aging. And I mean, you're 107 and you look great, so you must be taking your lipoic acid. Well, we don't really know about that one on the cosmetic side, but we do know that it should help with reducing the cellular aging. That's not nearly the aging you can see so much, but it is the aging that goes into the making cells more delicate.
And that's important. You know, you want to do everything you can.
Yep.
So.
The last piece that it does is it improves gene transcription of enzymes in the cells that regulate glucose levels and lipids. So this says that lipoic acid has been shown to modulate this particular gene that is a key regulator of the metabolism of lipids or fats and glucose. So what lipoic acid does is it switches those genes on so that you metabolize or use up more of that high glucose levels. And if your fats, if your lipids, your triglycerides are high, also uses up more of those too. It speeds up the rate at which the body can get rid of that. So not only are we talking about better function in the cells and protecting the cells from ongoing damage, now we're talking about actually bringing down some of the diabetic problems of high sugars and even high fats.
Nice.
So
Good. Powerful little supplement.
it is. It's a powerful little supplement. So most people at this point go, okay, well, how much do I need? What should I be taking?
That's a good question.
It's a good question. So I've got some info for you on that based on this research. But first, there is a caution here. And the number one caution for this is there's a potential that by taking lipoic acid, you may lower your blood sugar. And that's good, but if you're on a very controlled diet and you have a controlled insulin level, you could end up with little episodes of low blood sugar.
Okay.
And that can be dangerous for somebody who's diabetic. So before you just start taking handfuls of lipoic acid, run this by your doctor.
Right.
Make sure it's okay. And you may need to more closely monitor your blood glucose levels when you start taking lipoic acid. And it's a good thing that it helps to lower those blood sugar levels. But if you don't know it's coming, it, again, could be dangerous. You could pass out. You could have all kinds of episodes that can lead to injury. So check with your doctor and understand you may have to monitor your blood glucose levels a little more closely, at least in the first few weeks of taking it, to make sure that your blood sugars aren't dropping too low.
Right.
Okay.
You should always check with your doctor first.
Yeah, check with your doc first. This isn't just something to blindly order and just start taking recklessly.
Right.
Not because it could be harmful, just because it does change things, and that means your medications might even need to change.
Which could be a good thing.
Could be a great thing.
So.
Could be. So lipoic acid has been shown in a number of experimental and clinical studies to have a beneficial effect as a therapeutic agent for a spectrum of diseases, not just diabetes, but also for heavy metal poisoning. We already talked about that one. For radiation damage, for ischemia reperfusion injury, or compartment syndrome, stroke, and neurodegenerative diseases, which would be things like Alzheimer's, Parkinson's, dementia.
Interesting.
In addition to managing metabolic syndrome and diabetes and all those complications. And specifically in diabetes, it prevents beta cell destruction. Do you know what the beta cells are?
I've heard, but
They're the cells in the pancreas that produce insulin.
that's right.
And they're in a lot of cases very, very damaged early on by trying to overproduce, we think, trying to overproduce insulin, and they just become worn out. So by preventing this beta cell destruction, you can kind of preserve your ability to create your own insulin. Also enhances glucose uptake, meaning that you use up more of the glucose already in your body. Doesn't mean it makes you eat sugar.
Yep.
And its antioxidant effects may be particularly useful in slowing the development of diabetic complications such as diabetic neuropathy. So again, this supplement's not going to fix or cure your neuropathy, but it may help the diabetes or help your condition there, and it may help to slow down or prevent further or ongoing damage.
Right.
Okay? All right. So the last piece here is that it has direct and indirect corrective effects on all the mechanisms of diabetic neuropathy in particular. So in the conclusion here, they say, look, it might have a lot of really good effects, but we know it has a good effect on diabetic neuropathy in particular because it addresses so many different pieces of the cellular effects. However, one last piece, it does not necessarily improve blood flow, which is our other kind of pillar in trying to repair the nerves. So this is a good thing. In most cases, you're going to want to do this in addition to
Laser therapy.
There you go.
I was gonna
Exactly.
say, this is a great piece for, one part of it, but the blood flow piece, laser therapy is excellent.
Yep. Completely safe and works extremely well in preventing ongoing damage and reversing some level of the damage.
Well, it seems like lipoic acid is a very safe supplement.
Yeah, there's not really much listed in the studies that have been done for side effects. There was just one. Let me see if I can find it. There was just one study listed in here. No, I don't have it with me, but where somebody had sore throat. Several people had sore throat. Don't know what that is. And it's only been in really one study, so I'm not sure how often that really happens.
And for how long,
Right. It was pretty minor.
Yeah.
It was pretty minor. So maybe something to keep an eye on.
A great combination. So where do you get?
So where do you get
Alpha
it? You can get it all over the place. It's a very common supplement. I will say you want to spend a little bit of money to get a very high quality version of this. Don't get the cheapest thing you can find. Get a good lipoic acid. The studies show that you should be taking between 300 and 600 milligrams per day for somewhere between 3 and 12 weeks. What I like is I like to have patients take about 400 milligrams a day for about 8 weeks. Okay, and then if it's helping, if it seems to be making a difference, continue on with it. I also like what we have here, which is the Yarrow Formula's R Alpha Lipoic Acid. The R version is more bioavailable. It's the version that your own cells make, and you can get the regular version that it'd be S Alpha Lipoic Acid.
Okay.
Or a blend of both, and that's fine too. I just really like the R Alpha Lipoic Acid. I'll see if I can slide this up to the camera here.
So this isn't necessarily an ongoing forever supplement, or would it be?
For somebody that's fighting diabetes, probably a good idea to keep it going forever.
Okay.
Probably. But if you're not noticing really any changes after taking it for 8 weeks, I tend to tell people to stop taking it and then see if you notice a difference.
Okay.
Yeah. Some cases people are like, it's not doing anything. They stop taking it and they go, I'm having way more burning, tingling and stuff. And so then they can go back on it.
Okay.
But if you really don't notice a difference, this is not effective in 100% of cases. Mm-hmm. So what I will say, just to recap, is if you can get the R version, that's I believe that's more effective. But any of the the regular versions are okay too. Shoot for about 400 milligrams a day. Got to take it every day for I would say about 8 weeks to really see if it's going to be effective. But first, what are we going to do? Talk to our doctor.
Talk to our doctor.
Yep, exactly. Got to talk to the doc about it. Probably monitor that blood glucose to make sure we don't end up with low blood sugar issues. But it could be a really helpful supplement. I promise you, I'm not getting paid to promote this. This is one of the ones that I've seen work well. You can get any kind that you want there from anybody. I don't sell it to people. I mean, we have some here in the clinic, but we don't sell it online or anything like that.
Or anything.
No, so not at all.
Just available.
Yep, it's just something that's available and a good idea to look at.
Very good recommendation.
Thank you.
Yeah.
If you have questions on this or anything else that we've gone over, whether it's laser therapy or diabetes or peripheral neuropathy, feel free to browse through the rest of our episodes on Apple Podcasts or where else are we? Pandora?
We're on Spotify, Pandora. Go to the Laser Therapy Institute website, lasertherapyinstitute.org, under Patients, and go to Healing at the Speed of the Light. Speed of light, not the light. You know how that goes.
I know what you're talking about.
And you'll get the whole list. And it's just right there.
There's even a way to search for a particular topic on there.
Put keywords in, and you can search.
Yep. And usually 15 to 30 minute lately episodes that we've got. But some good information. And if all else fails, just email us. You can email us info@lasertherapyinstitute.org. You can also, on the website, find laser therapy clinics near you. So if you want to add in lipoic acid, you check with your doctor, you're good to go there. The next piece to do is probably going to be getting some laser therapy going.
Yes. It's going to work hand in hand.
Kristi, thank you very much for joining me.
Yes, thank you.
Have a good one.
You too.
Subscribe to this weekly podcast for more great information. Find a certified laser therapy clinic near you at lasertherapyinstitute.org. If you're a healthcare provider, check out our practitioner-focused Laser Therapy Institute podcast. Thanks for listening.